like you have this like imposter syndrome, like
and
this is real within the Latino community. Imposter syndrome is like so real because it's so easy to look at a field of lawyers and be like, well, everybody in this room's white.
Like you will be the person at the table,
and
you will be the one to advocate for students who look like you when everybody else shuts the door.
Facts.
You're gonna be like, no, run that back.
Yeah, run that back.
Run that back.
Never too shy, we're back. And we always like this like little like sing along intro thing.
It switches up. I don't know.
Sometimes we sing.
If you would like to.
I'm gonna let y'all
harmonize.
You could be a jack of all trades. You could
yes.
Not my forte.
Well, hey, you're in the right place though. I can guarantee you that. We're not professional singers either.
Right,
we're barely professional at this, so just kidding, barely. I'm Paulina, of course.
I'm Tati.
And producer Marco's here, and we have a very special guest with us.
Hello.
We have a doctor.
Doctor. Say his name, Paulina.
Dr. Domenech.
Hey, that's right.
I did it.
Wait, no, you say it because you had trouble.
Dr. Domenech.
There you go. Okay.
Yes, perfect.
Yes.
So a little background. Right before we came on, we all greeted him as Isaac because that's his first name. But I was like, no. On this podcast, like you are going to be called Dr. Domenech because I feel like you work so hard for this title. Like, you better check everybody who doesn't call you doctor.
My sister believes the same thing.
I agree with your sister. She's a smart woman.
I'm cool with Isaac, like.
That's
nice.
But if you want to call me Dr. Domenech, I'm cool with it too.
I mean, you're humble. That's beautiful.
Yeah.
You have to be nowadays, right? Okay, so today we are going to talk about a lot of different topics. First of all, it's not every day we have a gynecologist on here. We're always talking about just women lifestyle, women's health. So now we have an expert here. We don't need Webster's dictionary. We don't need Google. No, we do. We're
like Googling.
Producer Marco will just look stuff up while we're talking about it. So you are that. That's why you're here. You're like our very own Siri and Alexa, but like way more certified.
AI version. The AI version.
Yeah, literally. So we're going to talk a little bit about who you are, your background, because you have a very interesting story. I did my research on you.
Okay.
And then we'll talk just about women's health in general. Yeah. So I have my say it with my chest, and it's kind of related to women's health. So I could kick it off if y'all are ready.
All right, let's hear it.
Yes, ready.
Okay. So I think, and you could actually answer this now or later, I think it's kind of bullshit that our pep smears are only like once every 3 years, our annuals. I think that's just something to do with the insurance. I don't think it's real.
Okay, so
I don't agree with it.
What do you think it should be?
I think it should be annual, like once a year. I don't think we should wait 3 years.
Yeah, so I actually 100% pushing back against that. And the new update isn't even once every 3 years. It's once every 5 years.
What the heck?
If you do something called a primary HPV test. So you're probably thinking of something called a co-test where you do like a HPV and a pap smear.
Okay.
Which like tests the cells of your cervix versus the HPV virus itself.
Okay.
We've now moved to something called a HPV primary test, which looks at like different sort of HPV. There's like different HPV viruses, like 16, 18, 41, 42, whatever.
Yeah.
So now,
the vaccine doesn't protect against them all. That's what I've heard.
Not all of them, but it does protect agast the high risk ones.
Okay.
Which is the important things.
Right, because those are the ones that
16, 18,
cervical cancer.
Exactly.
Okay.
Yeah. They can all cause cancer, but those are but so I'm saying I push back, and the reason I push back.
I mean, good. I need somebody to tell me what I need to hear.
It has nothing to do with insurance. It's like a medical recommendation. Like that doesn't incorporate the insurance opinion at all. It's basically based off of research. Like if you ever heard of overdiagnoses? Meaning,
no.
So
I know how to think about it.
basically, the overdiagnosing is like saying like you're like screening too often, or some of the tests aren't incorrect, and so you can overdiagnose someone, and that can have implication itself. So if you have like an abnormal pap smear, you may have to get something done, a colposcopy, a LEEP, a cold knife, something like that.
Right.
And so what happens is, like with a pap smear, the reason we are now doing primary HPV testing is that we are just looking for the virus itself.
Okay.
So like a HPV pap co-test, that pap part looks at the actual cells of your cervix.
Okay.
And it tells you if there's any like abnormality in the cells. What happens is HPV, a lot of women have this HPV infection at some point in their life. Like it's a pretty common thing, but it doesn't actually result into much. Like it can like resolve. Your body's amazing. Like you as a human being can do so many great things that you have no clue your body's doing for yourself. a lot of women will clear the HPV virus on its own.
Yeah, like it flushes itself out, right?
Or like it is able to fight the virus off, kind of like clear your system. It doesn't progress into some sort of cancer.
Okay.
And so moving it to basically what they're showing is that if you have like some small, like there's like different grades of abnormalities on your pap. If you have like a low grade one, it typically will self-resolve. So you don't need to do testing every year because it will self-resolve on its own.
I think I'm a little biased. The reason why I believe that is because many years ago, you know, my mom had a mammogram, right? Totally different. But my mom had a mammogram and something was abnormal, but they were like, oh, I think they said it was like, oh, fatty cells or something. Well, when she went the following year, she actually had breast cancer and it was the same breast. And it was like, they said it was something else, but the doctor was like, oh, it probably was that. And we assumed. So like, I guess with when I'm thinking is like a lot could happen in a year. Like things could grow or form. So, okay, that's good to know though.
Well, first, sorry about your mom.
Thank you. She's great though.
Okay, great.
She beat it. She's amazing.
Oh,
Good.
amazing.
Yeah, she beat it. Yeah, she beat it. She's doing great. But yeah, and that's why like that, I think women's health in general is just something very important to me, for myself, my grandma, my mom, my future daughters. And it's, you know, we're recording this in October, so it's Breast Cancer Awareness Month. So I think it's all relevant to talk about all the things women's health.
Yeah, no, and that's like such a good point because honestly, like if you look at people, most of their like perception on what medicine is so tailored by their personal experience. So you had that experience with your mom, where you probably had this thought of like, dang, what if we were doing more frequent screenings? Could we have caught this earlier? And that's a real thought. You know, a lot of people have that, but to that point, like breast cancer versus cervical cancer versus uterine cancer versus ovarian cancer are so different in so many ways.
Okay. Well, that was my say it with your chest, and he knocked that shit down real quick. See? So there we go. I'm sure there's a lot of stuff I say that's not valid, but nobody's here to actually tell me. So I think I'm speaking like the truth. Like,
You think you hit it out the park? And it's like
I did, and apparently it was nowhere. Do you want to go next?
Yeah, you know, if we're focusing on women's health, what did you say?
Say it with your chest.
Say it with my chest moment.
Yours really matters because this is credible.
No. This is honestly the most biased thing, and like people are gonna be like, absolutely not. Some people will say yes. I think the most interesting organ in the body is the uterus.
Okay.
And you know, some people will fight in like the heart. You know, it keeps you alive.
Right.
The mind, the brain. You know, like it produces all the like everything you need. The uterus itself is honestly, if you really, really think about it, it's wild. You like, you know, when we're doing surgery and we're like doing like nothing related to the uterus, and you see the uterus, it's so small. Like it really is so small. And then to think that this thing can grow so large to not only host a baby, but keep it alive, provide all the nutrients it needs.
That was you a year ago.
That
was
like,
me. Your shit was growing.
You have like, there's so much about the uterus that like we just don't understand.
Yeah.
And how it operates, and how, you know, and it is honestly such a fascinating organ.
It is.
And people sleep on it.
They do.
Know?
And the placenta.
The placenta.
She's kind of cool too.
She is cool.
I ate my placenta. Well, I didn't eat it. I encapsulated it.
Okay.
This is a hot take. That should have been your hot take, because you know.
Say it with my chest. I ate my placenta. But like people don't want to do that. You're saying, or
you know, like not.
It's not
kind of like it's kind of like odd a little bit, and really? I'm not calling any patient that does it odd. It's just we don't see it that often, you know.
I want to be.
You know, it's funny because like at the hospital, if you are like a completely uncomplicated pregnancy, we can just kind of discard the placenta. Like we don't have to keep it. If there is some sort of
really, you just throw it in like the backyard trash.
Well, not at
you
know, like
there's
the
like a
hospital,
place. Okay.
Hospital disposal. But if you were to have like some sort of comorbidity during pregnancy, like hypertension or something wrong, you usually would send the placenta for something called pathology to see what was wrong with the placenta. And then my point in saying that is we know what to do with those. Like we know how to send it off.
Of course.
There's always that patient that's like, oh, I actually want to take my placenta home. And we're all kind of like, oh, what do we do? Like, oh, I don't like, you know, it's like so not common.
Really? Yeah. So like, what country is it? I think the Kardashians, maybe they talked about it. They ate it. Like they put it in the oven and ate it.
Did they?
It was
Courtney,
the little one. Yeah. Courtney.
Yeah. You can like literally eat it.
Saute it up
In the oven.
I wish
I didn't do that.
I don't know like the actual stats on like if it's healthy, if it's not healthy.
Yeah, I was gonna ask that. So the reason I did it was because I was told that it helps with postpartum and like it just gives some form of nutrients with like breastfeeding and stuff. I don't know how true this is. I don't know if there's research on it. There may or may not be.
Probably is, and I don't know it.
No, it probably honestly it's one of those things that's probably just like an old wise one of those.
Wise tale.
Yeah, that
Tale, right?
an old wise tale. I think they're wives, whatever. I think that's what it is. Because I feel like if it was like this like common encouraged thing, I think you guys would all be on the same page. But clearly, I don't think you're supposed to eat it. Like,
well, there are companies now that you can literally send them your placenta in a packaging, and they will encapsulate it and put it into pills.
That's what I took.
So that's what we did.
Yeah. I did the pills.
So
I still have them.
Did you feel a benefit?
I felt fine. I mean, like I didn't have like bad postpartum at all, and I. Like when I'm making my little list, I'm doing my own little like video about it because people ask me. And again, everyone's experience is different. So just because I did something doesn't mean like the next mom will have the experience. But I do think it helped. I felt like because it's a part of your body. So now that organ's gone for, you know what I mean? Your body's already like all fucking in shock because you just had a kid. A lot of hormones, a lot of things going on. I think it helped. I still have them actually.
Yeah. Well, see, that's I practice like shared decision making.
Oh,
if you are my patient and you're like, hey, I really think this is going to help me, then do it. You know, like I have, unless I know actual facts that say this is actually really unhealthy for you, I wouldn't recommend it. But if I don't, then we, together we can make the decision. And if that's what you want, that's what you want.
The girl who did it was like, just do me a favor. She's like, don't smell it.
Oh.
I was so scared to sniff it. Yeah.
There's
like,
a lot of smells in like obstetrics.
You think?
Well, it's an ecosystem down there. It really is, which is wild.
Yeah.
Of course. What's your say with your chest? Was it the placenta or
It's
something
the
else?
placenta one. I don't know. I just feel like I don't think, and this is a hot take probably, but like I feel like it's not fair that us women have so much more, I feel, health-wise to deal with. I'm not a man, so I can't speak to like what you guys do if you guys go to the pee doctor. I don't know, but like we do.
Oh, yeah.
Like, you know what I mean? Like, and it's like
we have special doctors for so many parts of our body.
No, for real. If you had an issue with your wang, you wouldn't like you'd go to the doctor.
GP wang, I love it.
Right, like you would go to the doctor.
This is how we talk to doctors.
I know, right? He's like, I didn't go to school for this.
This is the kind of patient I want. This is the patient I want. You know,
my doctor, Dr. Mike, shout out, who's actually his wife's doctor too. Marco's wife's doctor.
Shout out Dr. Mike.
This is how we talk.
Yeah.
He's probably so sick of me. He can't stand me.
Dr. Mike loves me, but
but you guys do it. You know, like I want, like, just to preface the whole podcast, like I am coming from, whatever we speak on women's health, clearly I will never experience. Like I will never experience birth, so I have no, like, no comment on anything. Like I just have like a medical expertise. But like I want people to know, like I am not coming at this like I should be telling women what to do. It's more of just, this is what I study, this is what I practice, and this is what I've seen. And I agree. Like
that's respectful. I like that.
Like, me seeing what women have to go through. Like the thing is, having a baby, and like just social media seems like so dandy. But when you're in medicine, it can be scary. Like,
it's all scary to me. I don't think it's dandy at all.
No, yeah. But
no,
I'm saying, like,
I used to think it was dandy.
You watch the movies and you're like, oh, this labor was so easy, and they had the baby, and now everything's happy. And the reality is, like, does that happen to the majority of women? Yeah, like, praise, like, good that the labor is good. But like in some cases, like, having a baby can be like a dangerous, scary thing.
Of course, for the mother's health, the baby's health, the minute you find out you're pregnant, all the way up to when that baby's born, and then when you die.
Oh, I mean, because I'm in labor. I was like,
no.
I was like, girl, that's morbid.
Yeah, no, right. I'm saying like,
no, you're right.
Until I'm dead, that's when I'll stop worrying.
You do, and
of course,
your ovaries will cause you problems. You'll go through menopause. You know what I mean? You might have a fibroid. You might have bleeding.
I mean, that's even now before you have your children, like your health and your lifestyle. Things you can control, things you can't control, that all plays a factor too. Like it really starts now, and it ends when you die.
Literally, like,
oh man,
when we're like 6 feet under. No, I know, but like honestly, I want to just say one more thing about that is, it's very true because you don't realize how many things can go wrong even during pregnancy. I mean, I'm sure like there's miscarriages that you've encountered with your patients. Like you never think it's you until it's you, and that's happened to me. So I'm like, oh, like you don't really think it's gonna happen, and it does, and it's so much more common, I feel. And sometimes there's multiple, you know what I mean? So I'm sure you see that. And then obviously once you guys start doing, if the patient chooses to do like genetic testing, there's stuff that could, result in that. They find out some information, which I want to get into as well, if it's accurate or how accurate that can be. And then the gestational diabetes testing, I had that. Oof. So that was a great.
The glucola.
That
tasty sugar drink.
Delicious. So my baby was, I was induced because they didn't want her to be too big. I mean, the girl was 8 pounds, 8 ounces, but it's weird because she didn't feel
She's
big.
so tiny.
She's the tiniest girl.
You just met her. She's like the tiniest little baby.
Oh, that was your girl.
Yeah,
she's beautiful.
Did you think it was?
I don't know who. I didn't know who it was.
That was your mom.
I saw some woman holding a baby. I was like, oh, beautiful baby.
Yes.
Oh, it's your baby.
Yes.
That's
gorgeous.
her baby.
She's gorgeous.
Yeah, that's her
Thank
baby.
you. Yeah, she's like tiny. So I'm like, where did you come from? But
Yeah.
I mean, the diabetes. And there's just like so many other things, like you said, like the labor and stuff. And then I'm on TikTok. I call it torture talk because my algorithm is always like shit. It just makes me sad. And I like to be in this sad bubble. Don't ask.
You do it to yourself.
I do it to myself. I do it to myself. But like there's stories that you come across and you're about to give birth. And then there's like, unfortunate, like there's like stillbirth stories. SIDS, and I'm like, oh my God.
Yeah, it's heartbreaking.
Extremely. Yeah. So it's just it's hard.
But to that point, I will say it is, if you focus on that, it becomes like a very scary thought.
Yes.
Like I said, the majority are very uncomplicated, and it's a beautiful thing.
That's like, reassuring.
Yeah,
that's
like
reassuring.
The vast majority. Yeah. So still do it.
I love it.
So what even got you in women's health to begin with? Like when you were born, how old are you? I don't even.
The day you were
Can
born.
we say how old you are?
Yeah, I'm 27.
You're
27.
He's a baby.
You're a baby.
How old are you guys?
Old.
Not
I can't ask
27.
this.
Not 27. See?
We're on the third floor.
Yeah, we're on the third floor.
We're on the
so
third
you
floor.
do the math.
I want to be a doctor. I want to specialize in gynecology. What did that look like for you?
Yeah, and honestly, it really like has to deal with how I was raised and the circumstances I kind of went through. I was raised in Kentucky as a Latino, which, in the 90s, there's not many, as you can imagine, not many Latinos in Kentucky. My mom's Cuban, my biological father's Mexican, but I was raised by a single mom. My mom has a crazy story, genuinely. She was born and raised in Cuba her whole life, and I don't know if you guys know much about like Cuban government, but like socialist, aka dictatorship that controls everything and like basically keeps all their people at a very low level so that they can't prosper. And so my mom and uncles were genuinely at a point where they were like, we would rather risk our lives than continue living in this like living condition. And so my two uncles built their own raft and then escaped Cuba and sailed to America.
Wow.
And they hid my sister, who was 5 years old at the time, in a duffel bag, just like sneak her out of the country so she wasn't caught. And on their way, they ended up getting caught by the U.S. Coast Guard and spent about 6 months in Guantanamo Bay at like a refugee camp there. And then they were separated, and my uncles were sent to Louisiana, and my mom and my sister, who was 5, were sent to Louisville, Kentucky, which is like the most random place in the world, but like now actually has a huge Cuban population. But my mom came to America, didn't know a single person, didn't speak any English, didn't have a college education, and so generally just did whatever she could do to get money. So she like her first job in America was like a Burger King. Then she like walked some horses at a horse track, and then ended up cleaning houses for the remainder of her like working life.
Yeah.
But as you can imagine with that, like we were raised pretty poor. There was like, in the community we were in, there was like a lot of addiction, a lot of mental health issues. And so that created like this really kind of, I don't know, a poor environment. Yeah. But my mom was the most loving person I've ever met in this life. And she is like genuinely, from the bottom of my heart, the most supportive person I could have had, and the reason I've gotten where I'm at. But she has like this famous saying that she would always tell me. She would say, it's not your fault that you were born poor, but it is your fault if you die poor.
I agree 100%.
So
wow. Wise woman.
Off rip, she was like, hey, like this is where you're being raised, but you don't have to stay in this. And she was like, she literally every day study, and would tell me that's how you're going to get out of here. And so like early on, I was pretty good at math, pretty good at science. And, my mom kind of knowing that doctors make a lot of money was like, be a doctor, be a doctor, be a doctor, And so me as a little kid, I'm like, oh, I love science. I must be a doctor, So then I got to high school, ended up finding this amazing college called Berea College, which, quick little snippet on it, is like this liberal arts school in Eastern Kentucky that every single student that gets accepted gets an automatic full tuition scholarship. Like nobody has to apply for it. And it only accepts students from low-income households. Wow. And they make every student work like 10 hours a week, which is nothing for a full tuition. But I ended up going there.
Beautiful.
you have to work 10 hours. My first boss I ever had was Esther Livingston, who is by far one of the greatest mentors I've ever had in life. And she asked me like early on, like when I first met her, like, oh, what do you want to do in your life? And I was like, oh, I want to be a doctor. And she was like, okay, great. Why? And I was like, well, I'm good at math and I'm good at science. And she's like, no, absolutely not.
Right.
I need you to have like a legit answer for why you want. If this is what you're going to commit your life to, you need to have a legit answer. And so she kind of encouraged me to do some internships. My freshman year of college, I ended up doing an internship at the Cleveland Clinic, which is like, one of the top 5 hospitals in America. And it was what a wonderful experience. I got to work with 2 different doctors. And I like left that experience saying, all right, this is it. Like, this is what I want to do. And then next year I had some more mentors like, okay, but what about research? And so then I did some research. I did like my second summer of college, I did research at Vanderbilt. And then my third summer, I ended up doing research at Stanford. And I kind of to the conclusion that I was like, all right, research is not for me. But I love clinical care. I love clinical care. So I'm going to go into medicine for that. And so I applied to med school, ended up going to the University of Kentucky College of Medicine, which is in Lexington, Kentucky, like an hour and a half from my mom. So I was still pretty close to home. And really, I went into medicine for a humanitarian aspect. Like I went into medicine thinking, I don't know a single like nobody in my entire community, my entire life growing up, I never knew a single doctor, like personally, Right. So nobody like told me like, oh, this field of medicine is really cool. This field of medicine is not that great. Nobody told me that. I just knew that in medicine, I could help people like my mom, like people like my sister, right? Because like imagine beautiful. My mom didn't speak English, and she has a lot of like chronic like comorbidities, like chronic medical conditions that my entire life growing up, going to the hospital, being her little translator at 8, 9, 10, you guys probably know, right? Like so many doctors failed to provide her equitable care. Like so many doctors failed to acknowledge that language was a barrier and did not take any steps that sort of like help her. And I remember seeing my mom frustrated. Like she would leave her doctor's visit, like, what was the point of that? I don't know my condition. I don't know how to take my medicines. And so for me, it was like, if I go into medicine, I can get to focus on the Latinidad, like Latino community and helping my people.
Beautiful.
And so I went into medicine for that.
Wow.
But I had no clue, like what field, right? Because there's so many fields of medicine: surgery, pediatrics, internal medicine.
Okay. So it's like you got to kind of pick a.
You do. So your first 2 years of medical school are purely book work. Okay. I mean, depending on what med school, but the majority of med schools, the first 2 years are just book work. Like you are studying genuinely 12, 14 hours a day, every single day, and then taking these 3 to 4 hour exams. But then the third year of med school is when things get interesting and you have to do your rotations.
Right.
So everybody has to do the same rotations, but they do them in different orders. So some people will do internal medicine first and then general surgery for 8 weeks and then family medicine and pediatrics. And OB-GYN is one of like the main rotations. And so early on, I told myself, I don't know what field I want to go into, but I know I want to do I know I'm going to go into this year and I'm going to do everything full-hearted. And whatever I like the most at the end of this year is what I'll decide to do.
Okay.
That's
so
fair.
I ended up doing like general surgery like early on, and like realized very early, like quick, that I love the operating room. Like the thought of being a surgeon was the coolest thing to me, and I was like, okay, like maybe. But the culture at the med school I was at, like general surgery was kind of like, I don't know, macho, and like everybody had an ego.
Oh, wow.
And everybody was like trying to fend for themselves and look out for themselves. And I'm just like at heart not that kind of person.
I mean, just meeting you don't give that vibe.
I'm not like, my mom raised me so differently. Like I'm very team oriented, very community based, and I just didn't get that. So I was like, okay, I love the OR, but do I want to sacrifice that and be part of this environment forever? And I was like, I don't know. And then I did pediatrics right after that and loved peds, like loved working with kids, liked working with the parents. And so I was kind of stuck between those two. And then my heart was like low key broken because I was like, if I do peds, I won't get to be in the OR.
Oh.
So I was torn for literally months about which way am I going to go? And I ultimately, like 2/3 into my third year, you have to decide, like, what is your fourth year going to look like? Because you have to pick your classes.
Right.
So you get to like make your own schedule. And so I was like, man, I got to pick something. So I ended up picking peds. But genuinely deep down, I was so sad because like, I want to be in the OR. I want to be in the OR. I want to be in the OR. And my very last rotation of third year was OBGYN. And to be quite frank, I had no clue. I didn't know anything about women's health. You know what I mean? Like, I hardly knew what a pap smear was. Like, you know what I mean? Like, I kind of heard of a uterus and what it does. Like no clue. And then I did the rotation, and genuinely within days, I fell in love. Like I was like, I found it. Like, this is what I've been wanting to do. Because what people don't understand is like OB-GYN You have the obstetrics and the gynecology. Obstetrics, you get to know your patients so well. You get to like follow people for 9 months at a time. You get to be part of the delivery. And then the gynecology side, people don't really understand that OB-GYNs are actual surgeons. You know, we're in the OR, we're operating, we're doing legit. People just think it's just C-sections, which C-sections are surgeries, but we also do a lot of other surgeries. And so it finally like combined my passion of like, wow, I get to, and on top of that, by far, OB-GYN in the hospital I was at saw the most Latinos. Because like, I don't know if you guys had this experience growing up, but my family, like if they were sick, they were like, I'm sick, but I'm not that sick. So I'm not going to go to the doctor. So they always like held off. But if you're pregnant, you're going. You know what I mean? Like you're not going to hold off on prenatal care. So I saw so many Latinos. I use my Spanish on a daily basis. And
that's incredible.
That is incredible.
Like doing God's work, I swear.
Yeah. And I was like, man, I cannot believe there's a field that combined everything perfectly. And so that was it. I like switched my entire 4th-year schedule. I called different rotations that I had scheduled. And I was like, hey, can I switch this to OB-GYN? And people were cool and let me do it. So.
And what are like some of the like the misconceptions or maybe like isn't talked about, right, in the Latino community when it comes to women's health, right? Yeah. Like maybe let's say like our grandmas or like, you know, maybe like the older women, or because obviously Tati and I, like we were born here, we have our culture, we carry it on our back, but we go to the gyno. We're very aware of what's going on down there. But like for those, I mean, and I completely understand like there's like a language barrier, right? Or there's you know, not having insurance. I'm sure there's a ton of different reasons why, but like I guess like what's like the like what's the barrier between that, right? Like the Latino community, it can be men and women, but we're talking about women's health. And then, you know, getting that health care and access to it, but also like wanting and understanding that it's important to go. Yeah. Like, where's the disconnect?
Yeah, I feel like I personally, and this is purely from my experience with my mom, I just feel like the barrier's trust.
Trust.
You know what I mean? Like I feel like my mom looking at medicine always thought that she was, they were trying to exploit her.
Really?
Like they were trying to sell her this medicine. They were trying to like give her this device. Like I genuinely like saw that growing up when my mom like kind of always questioned what the doctor would say. Like, are you doing this for your benefit? Or are you doing this for my benefit?
Interesting.
And when that's your perception going into medicine, it's kind of hard, you know, especially when you don't feel like someone cares for you. Like if you feel, if you're going into a clinic and you feel like your doctor's rushed, it hasn't looked at you once, has only looked at their clipboard or their computer, and they're just typing and asking you questions like verbatim as a computer. That creates mistrust. And when when that is the feeling you get from the doctor's office, you are reluctant to go. You know, you're like, oh, I have an issue. So, but you know, like if you have this relationship with your like OB or your gyno, and you're like, wow, they care for me. I have this one slight issue. I don't mind going to them. And you're quick to go. But if you have mistrust, you might have something small and you're like, I'm not really trying to see them. You know, like I'll wait until it gets worse kind of thing. So that's from what I've seen. It's like for the Latino community in medicine, trust is a huge barrier.
It's interesting you say that because, you know, as a young girl, like I would go with my mom to all her doctor's visits. She brought me everywhere. And so I remember all the doctors. I could truly name them now, even from Northwestern. And the best one she had, I'm not lying, they're all African-American women. Yeah. For some reason, I don't know what we call it, the bedside manner. I don't know what you would call it, but Anglo-American doctors never had that. And it wasn't like, oh, we assumed it automatically. It's just at a young age, even now as an adult when I go with her, like Dr. Connie Moreland, she was from Northwestern. She was amazing. She saved my mom's life. And then Dr. McNair, who's at Northwestern. Moreland.
Dr. McNair, I know McNair.
And then Dr. McNair.
Oh, amazing.
Wow.
She's
Robbie McNair.
Yes.
Love her. Amazing.
She's amazing.
Yeah, shout out.
And I mean, these are women who like truly have a relationship, talk to their patients, hear them out. And, you know, I'm not going to talk about my mom's health on here, but Dr. McNair was like the perfect example of we're not going to rush anything. Giving a sense of mind, you know, when you're stuck in a situation where you feel like, oh what's going to happen next? She was very good at like giving a sense of mind, saying we have a plan. We're going to play a waiting game, but here are all the different avenues we could go. Yeah. Luckily, everything was perfectly fine. But it was just such a beautiful relationship that she has with my mom, that my grandma went to her. And then I'm on the waiting list. I'm still trying. Put in a word for me.
Granddaughter, you in.
I know. No, for real. Like, I'm trying to go to her. I'm on a waiting list.
Dr. McNair.
Yeah, I hope you're watching this. Shout out. Yeah, but I don't know what it is, but it's been always African American women who have been the best doctors. I could only speak for my mom, for my mother and I, that have been there where we felt, like you said, like we wouldn't second guess if we had to go to them.
Yeah, you know, and I hear that, and that's like beautiful that they could provide you that experience. And I really think there's like this shared experience amongst Black women and Latina women, because in so many ways throughout history, dating as far back as you can imagine, these women have been marginalized, especially in the medical field. And so as a, for example, as a Black OB-GYN, I'm sure that there are women that are practicing medicine that said, I had a bad experience.
Yes.
And I understand that this Latino woman, even though she might not be like skin color, my skin color, she has also gone through her fair share of adversity navigating medical systems. So there is this level of compassion of like, I understand what you're going through. And even though we're not the same race, like I know that you've gone through the same thing and I can provide you that care, which is honestly, to another point, so why diversity in medicine is so important.
Yeah.
You know what I mean? Like you have to have the diversity, not even just skin color, like, like religion, like sexual identity, all of these things. Because if you just have one sort of group, you're never going to be able to advocate for the other people. So you have to include a little bit of everything so that everybody's like getting just care.
That's so true.
I agree.
Absolutely.
And like, speaking then of like, when it comes to Latinas, right, and Black women, mortality rates, I know those are statistically, I can speak today, they are higher.
Yeah, they are.
What would be some of the reasoning behind that? Is it kind of what we discussed? And like, if my doctor, I'm just theoretically saying that my doctor is a white older man, is it because he just isn't caring for his patient as much? Is he not, I don't know, listening to this patient? Because I heard too on good old TikTok, but women share their stories of like, this happened to my birth, my doctor didn't listen to me. And these are Black and brown women sharing these stories.
Yeah. And that's real. Like there's data. I wish I knew the exact numbers. I don't, but I know for a fact there's data that shows that, Black and Latino women have higher mortalities in like obstetric care back settings. And I think, like for example, something I do know is that Black women's level of pain is perceived differently.
I was going to say, that's what I read.
Like a Black woman can say, I'm in pain, and it's perceived like less severe than if somebody else of a different skin color were to say I'm in pain, and it's taken more seriously.
Wow.
Like, and so to your point, like, if you go to a white male, I don't know. I really do think it's like provider dependent, because I know some amazing doctors at Northwestern that probably identify as like male white.
Of course. Yeah.
And so I'm,
100%.
But there is stats to back it up that like Latina and Black women have higher mortalities, and the way they are presenting their symptoms may be perceived as less significant or less severe. Yeah, which is true. Scary.
Absolutely scary.
So.
Oh yeah, no, I think about that a lot. It's sad, and it's hard too. Like when your provider or your doctor isn't necessarily like listening to you, right?
Oh,
and like your needs and stuff. Especially like being in the delivery room and stuff, and having a baby. There's nothing more. What's the word I'm looking for? There's nothing more like, I don't know. You know what I'm saying? There's nothing more like, not even just scary, but like there's nothing more vulnerable than that.
Yeah. No, that's real.
That's
real.
That's interesting.
And like obstetrics in general is just like you are putting yourself in a vulnerable state.
Yeah.
And a lot of things can go bad. When a lot of things go bad, I can imagine from the perspective of a mom, things look scary. Like when the baby's heart rate goes down, and then 6 nurses and 2 doctors rush in to check, you're kind of like jarred, and you're like, what's happening right now? Or like if a crash C-section happens and you're rolling, and there's 10 people around you, and then you're in the operating room and everybody's trying to like hustle and bustle to get everything set up, you're probably like petrified.
Yeah, no, absolutely.
I mean, I feel like you probably hear this all the time. Like women are choosing to have babies a little bit later in life.
Yes.
And so I am on the 3rd floor. I'll just say I'm 32. Okay. And so I'm not in a position to have a baby just yet. At least I'm not trying to have a baby. But I know down the line, I do want to be a mother. So a lot of people had told me, you should actually start freezing your eggs now. So what can you say about women like me who eventually want to have a baby? They're just not ready for that now.
Yeah, I think freezing your eggs is a great option. But here's the issue. If you can afford it. Like, and that is like a real issue. Is that this is you're probably you're referring to more of like REI, like reproductive endocrinology and fertility sort of specialists. So that's like a specialized group, and then to freeze your eggs is a whole process that does cost a lot of money. So if you have insurance, great, you might have a copay, you might have a deductible or whatever, and you might still have to pay a lot, or if you don't, it's straight out of pocket. That's expensive. So like if you have the means to do it, honestly, great. Like, do it. Like, I would recommend it. Like, if you are like, I am like focused on whatever you want to focus on. Hypothetically, let's just say you're like, I want to focus on my career right now. I just
want to become a doctor in a year and a half.
Yeah, and you're about to.
My 2 doctor
friends. Out some babies.
PhD, and you should, right? Like, if you want to say, I want to focus on that and not worry about a kid right now. I want to have a kid when I'm like 37, then do it. Like, I genuinely think it's a great idea.
So what is the process exactly? Like, what does freezing eggs look like?
And why do people do it? I'm curious.
Yeah.
Obviously, Tati was saying I want to have kids later. I see that later in my life. But why then would she go through this process? Like, can't she just bang when she's 38 and have a baby? But
that's a great
obviously,
point.
But some people are just probably I'm not that familiar.
So, to your point, like I honestly probably won't say too much about how the process goes because like I'm not that familiar with it. So the reason I say that is like what we're talking about, you would have to do an additional 3-year fellowship. So OB-GYN residency. So I'm like, I have my MD. I am a doctor, but I have to be supervised because I'm still in training.
Yeah.
So that's 4 years. If I were to graduate, I would be a generalist. If I wanted to do that work, that's 3 more years of fellowship. And like, I know some of the gist of like IVF and egg freezing and like you have to like have hormone injections.
Yeah.
You have to like have like frequent ultrasounds and like, and then like on certain days, you're going to get certain labs drawn. And then like, I've been in the suite where you get your egg retrieval and I'm familiar with the process, but I don't want to like spew misinformation, right?
Yeah.
So like, I don't want to speak too much on like specifics about like the process itself, but to like answer your point, why do it?
Like, why do women do it?
Once you're like, essentially like your body can like your body, your uterus can physically have a baby. Like even if you're like 40 something, you can physically hold the baby.
Correct.
The issue isn't your body. It's not the uterus. It's the eggs.
The eggs.
So you're born with your lifetime reserve of eggs.
When we're like a day old, we have like so many, right?
And so every year they're kind of like dying off, and that's fine because you have so many reserve. But what happens is once you get to a certain point, your level of like mutations in the eggs increases like exponentially. And so we usually say that's like around 35.
Okay.
So like once you're 35
Which is
and above,
insane. Isn't that called a geriatric pregnancy?
So we say the official term is advanced maternal age.
Okay, we're not using that. That's like the slang name. I hate that name. That's why I'm saying it. I'm like
the old name.
Back in the this is more socially appropriate. Probably.
Okay, good. Because I'm like, I literally hate that.
Advanced
Say
maternal
it
age.
with us, everybody.
Advanced maternal age. Okay. AMA.
Okay.
So that's usually classified at like 35.
Okay.
And the reason is because you have like a higher probability of having genetic anomalies in your eggs.
Okay.
And every year that like grows more and more and more. So like really when you're 40, it's like pretty dangerous to have a kid.
Really?
Like your chances of Down syndrome, of trisomy like 13, 18, different genetic anomalies like that increases. So are there women out there that my mom had me at 37 and I'm like perfectly healthy. So like I'm not saying it's impossible.
You're a doctor.
Yeah.
I could have a doctor.
My mom,
There you go, doctor.
So like it's possible. I'm not you can be 39 and not do IVF and still have a kid.
For sure.
You could.
Yeah,
absolutely.
Yeah.
To your point, why do it? You are almost kind of like, I don't want to say guarantee because you're not guaranteeing anything, but you are optimizing your probabilities of having a very healthy baby.
Okay.
Because I'm taking the eggs from today.
You're taking the eggs from today, You're taking the eggs at 32, which are very healthy eggs, and you're freezing them. And when you are ready to have a baby at 38, you take that egg, that 32-year-old egg, and you put it in your body, and it produces a baby. So it's healthy in that sense.
Yeah,
so it didn't accumulate all of these genetic mutations throughout the years. And like there's a part in that, like you can genetically test your eggs as well. Like, I don't know if people know that. Like,
I've heard of this.
You can freeze your eggs and then genetically test the egg and see if that egg is actually genetically normal.
But egg retrieval too can painful, no?
Yeah, no. Yeah. And there can be complications with it.
Oh, wow.
So in order to get your eggs retrieved, you have to get like a subset of hormone. Like, they give you injections, hormone injections, because it has to stimulate your body to produce the egg. So the whole point is that, like, naturally you are producing like one egg yourself a month. That's like your ovulation. Like, that's your period, you know? With IVF, you are essentially causing your ovary to produce 10, 20, 30, 40 eggs. And the more eggs you retrieve, the higher success rate you have, like the higher chances, probability you have of having a successful, healthy embryo at some point that you can transfer. But the other thing, like the other dangerous side of that is, like, the more eggs you retrieve, you can actually have something called like ovarian hyperstimulation syndrome.
Oh, wow.
Which is where you retrieve too many eggs and now your ovary is too inflamed.
Jesus.
And you produce too much hormone that causes your body to get leaky, and you can get like a lot of edema. Your belly gets really swollen. You get really painful eggs. So that is rare. I don't want to say rare, but it's not very common.
Got it.
You know, so it's not the majority of cases. The majority of IVFs go well, but like, it comes with like a risk.
Right.
You know?
Oh, wow.
But
The
to
more
your
you
point,
know.
the more you know.
The more you know.
Yes. No, this is good information for like
great
our listeners
information.
and people in general. Because I have a friend who's considering as well, just like you know, and her mom, I think, had a baby at like 41. It's possible.
No, yeah,
completely.
100%.
It's just I can see the probability.
It's just you want to think about the health of the baby, your own health. Like, that's actually number one. It's not about like,
I wish I knew the
I'm
number.
older, but
Don't quote me on this. Do not quote me on this.
I won't,
But
I
like,
promise.
it's some sort of number that like age 45, you have a 1 in 10 chance of having a kid with Down syndrome. Like, it's that crazy, you know, like, and that's not the probability at like 35. Like I said, it's exponential. So it's like, but once you get older, you know, it's pretty like high risk.
So I kind of want to go almost opposite of that. We're talking about like getting pregnant. Now I want to talk about birth control.
Yeah.
Yes, not getting
Because
pregnant.
no, not even about like the pregnancy issue. Like a lot of women take birth control to help control their menstrual cramps or just other reasons. But I don't know if this is a hot take of mine or not.
I want to hear it.
But I just feel like
Say it with your chest.
birth
part two.
control is always like, oh, you have a lot of bleeding? Birth control. Oh, you have like really severe cramps? Birth control. Rather than like really, really diving into like, why are you getting all of this? So like, for example, like endometriosis and all this, like, yes, you know, there's tests for that. You test that. But it almost seems like if you don't have endometriosis, well, then just use birth control. And that kind of like solves all the issues. So I guess I don't even know if it's a question or a statement, but like, what's the deal with birth control kind of being the Band-Aid?
No, yeah. And that's a great point. I will say, the way we practice and the way I've been trained is you should always evaluate for a cause.
Right.
Like, if you are a woman coming in with what we call this abnormal uterine bleeding, that's what we call it. There's like different etiologies. Like, we have like this like mnemonic called Palm Cohen, and it kind of walks us through different causes of abnormal uterine bleeding. It can include polyps, fibroids, malignancy, coagulopathy issues, stuff like that. You should, if you're going to your doctor, they should not initially just give you. They may give you some birth control to work you up so that you can stop bleeding in the meantime, and that they can do an appropriate workup. But that should be always what they're doing. They should be working you up to see, do you have a fibroid? Do you have a polyp? You know, what's happening? You know, like, why are you bleeding? That should always be the case.
Yeah, for sure.
For example, like a fibroid. If you have a fibroid, the best thing to do is remove the fibroid.
Correct.
But not always, though, I was told.
Yeah. You could. So like, yeah, that's a good point. Like,
I'm the doctor. I'm saying. Right? Ask me all your questions.
you know, but like,
Paulina versus a real doctor.
I know, not
there
me.
are options to treat fibroids.
Yeah,
but like, if it's like if you can have fibroids on the outside of your uterus that have nothing to do with bleeding.
Right.
That's So like,
maybe,
if you have a fibroid inside the lining of your uterus and your endometrium, and that is what's causing your bleeding, removing it will solve it. But if you have a fibroid on the outside of your uterus, there's no point, and you're having abnormal bleeding. That fibroid's not causing that bleeding.
I had a fibroid somewhere. I can't tell you where. I really don't know. But the doctor, because I was not getting pregnant, so I was like, oh, okay, like maybe that's the reason. And we don't know to this day, but I did ask her, like, should we remove it? And she said it was not worth it. I want to say because it was too small. So she's like, maybe it won't even really do like anything. So I was wondering too how invasive that must have been for her to even be like, don't even do it.
Yeah. So to that point, so like for example, for your fibroids, if you really think about it, we have classifications of fibroids, but if you really simplify it, they can be in 3 places.
Okay.
They can be on the lining of the uterus, which is where, if you're trying to get pregnant and you have one, it might infect implantation because it's on the lining of where an egg, like where your embryo would transplant.
Okay.
So if it's in the lining, yeah, it can affect your fertility. You can have fibroids in the muscle of the uterus. That's called intramural.
Well,
or you can have you can have fibroids on the outside of the uterus called subserosal. But yeah, so like it's
but they can be there too, not cause
exactly.
issues
So
too,
if they're on the outside or if they're in the middle, they may not actually be causing you any issue.
Issues.
You may not have any symptoms.
Why do we get them? Do we know?
It's honestly just benign it's like overgrowth of benign tissue.
Okay.
So it's not like malignant. It's not cancerous. It's just overgrowth. So it's hard to know.
Interesting. Your thoughts on the old Ozempic and the semaglutides and all that? Have you guys been researching that?
So for what? Researching in what? In
fertility potentially, or helping with PCOS, and all of that. Is there anything going on in that world with?
I want to be so honest. I don't know about the research itself, but when I think,
but you see things, I'm sure.
But when I think about Ozempic, the biggest thing you hear about Ozempic now is weight loss.
Correct.
One of the an actual cause of infertility is a high BMI. It like actually messes with your ovulation. Like your adipose tissue, like fat tissue, has it has like this like enzyme that can convert things to estrogen, and then can cause your like hormones to be funky, and can make you like anovulatory, meaning you don't ovulate.
Got it.
Which you need to ovulate to have a baby. So if you're able to address BMI, like if BMI is your cause of infertility, and you're able to address BMI by losing weight, you can increase your chances of being fertile. So I don't know actual research on Ozempic and fertility. Like there
won't be for a couple years,
I can't give you numbers. I don't know, but I can imagine like.
Well, there's a spike, and I feel like, do you see it?
Spike in what? Ozempic?
Well, that too, but a spike in like pregnancies.
Oh, like more and more people are being pregnant?
Yeah, I'm one of them.
She's like,
doctor, I dead ass think, because I was getting pregnant for over a year. Okay. Yeah. So at that point I was technically going to go to a fertility specialist. Yeah. Correct. I was on my way, literally in my little car. Yeah. I was on my way, not really, but like I was like planning on it. I was like getting my phone book ready. I'm like, I'm going to call them, all these things. Yeah. The yellow pages. Yeah. So then I was like, let me lose some weight though. Everybody's on this like semaglutide. Yeah. Couldn't get the real Ozempic, but I got the semaglutide compound, whatever. Yeah. And I injected myself, and my friend actually hooked me up with Mounjaro, and I did that. And next thing you know, I'm getting married too, and all of this. I had a wedding coming up. Oh wow! Yeah, it was great. Thank you. No, it was a good time, and I had a Vegas wedding too. Yeah, they were there. I had a Vegas wedding, and I was like, oh, I'm gonna be so wild, it's gonna be crazy. And I was 3 months pregnant at my wedding. Because I was like, nothing's happening. Like, we don't have to be protecting ourselves. Like, nothing's going to happen. Like, it's been over a year.
You were thinking, like, we were having issues getting...
Right. Why would I just get pregnant now?
Let's just do it.
So, that's... Well, you met my baby upstairs. Like, that's exactly
what a blessing.
It was a blessing. It was such a blessing. She's the biggest blessing ever. But I just think it's so funny because I swear to God, she's my little... I call her my Ozempic baby. But then I went on TikTok and internet and everywhere, and everybody's saying, like, this is happening. People are getting pregnant. Now, I was overweight, but I didn't drop like significant, like 40 pounds. Like I dropped like 10 pounds.
No. That I literally was about to say 10. Dropping 10 pounds is
it like, could have, you guys.
No, it does. It does. Like, we even say it. We tell people like dropping 10 pounds will make a big difference for you.
So maybe right
when it's time.
Baby.
I know they say a lot of people, they're calling them like Ozempic babies, like a big boom or whatever. So I think it's just like so crazy. Everyone's saying like, if you're on Ozempic, like be safe. Yeah. But I heard though too, it helped a lot of women with like PCOS, which for those who don't know, what would you describe that as? PCOS?
Polycystic ovarian disease or syndrome.
So that's different than endometriosis.
Endometriosis.
You almost had it. Had it. I love it.
What is the difference between those two?
Yes.
So endometriosis. So essentially, when you bleed, you are bleeding from your endometrial tissue, like the lining of your uterus. Okay. Which is just the inside cavity. What happens in endometriosis is that those cells, for some reason, kind of honestly like mysterious why, are implanted in places they should not be implanted. Like those cells should only be on the inside lining of the uterus so that when you bleed, it's in a cavity and then it comes out of the like the cervix through the vagina and you're bleeding. That's like, that's a period. What happens in endometriosis is those cells are now implanted in other places. They're now implanted on the ovary. They're now implanted on the abdominal wall. So when your body is sending these hormone signals to your uterus to, hey, it's time to bleed, it's time to have our period, not only is the lining of your uterus bleeding, now all those little implants that are on your ovary, implants that are on your abdominal wall are also bleeding. Wow. And that bleeding irritates the inside because it's not in the uterus. Now it's in like the actual, so that's endometriosis. Polycystic ovarian disease just has to deal with the ovaries. It basically like means you have too many cysts on your actual ovaries. Oh, okay. So that's what it is. Like it's the ovaries themselves having too many cysts and it leads to infertility because you're not ovulating.
Got it. Okay.
Right? Like, you're supposed to have one dominant follicle a month that turns into like your egg that's ovulated. Polycystic ovarian syndrome, and a lot of people don't have that.
And you can also have a period without ovulating.
Yeah, exactly. Yeah.
So sometimes.
So the period is just the fluctuation of hormones. And when you take one hormone away, progesterone, like when progesterone comes off, when your body, like you have like every month, if you're having regular cycles, you have like this regular, almost like rhythm of when your hormone, like this one hormone goes up at this point and then it comes out.
Correct.
And this one it goes up and then it comes out.
Yeah.
So you bleed because your progesterone's now going low.
Right.
So that has nothing to do with you actually ovulating. Like the ovulating is the egg itself being released. So you can bleed and not ovulate.
Yeah. See?
Is it so from your like we're really diving in here with these questions.
I feel like it's like a medical podcast.
I know, I'm sorry. Like we had like so many. Let me tell you something. You were a very interesting person that we could easily like have different segments, but we're like it's not every day we have a doctor on here. Yeah. But is it true that like you should be not switching but thinking about your like the way your nutrition is and your energy level during all these phases of your cycle?
Good question.
I want to, I'm always very candid. When I don't know, I don't know.
Okay.
I don't think I know the answer to that.
Okay, I
actually follow people that are like really in tune with their, like women that are posting about being in tune with their cycles. Like on this time of the month, you should be working out this hard.
Right.
And when you're ovulating, you should cut down a little bit. Okay. So that kind of stuff I really don't know. Maybe I should know. Maybe I should study a little more. I don't know it.
Yeah.
I wish I knew.
I think that's like
important.
newer though too.
Yeah.
Like I mean, my mom, did your mom teach you about that? I don't know we even had phases except
I learned
you get your period.
Like you're probably gonna want chocolate. Like,
you're gonna be sad.
You're gonna be or mad. You're gonna feel bloated. Like
that's how we're told. But now like you're right. There's like an influencer, like this radio girl that I follow, and she does 4 phases, and she'll call herself like my luteal phase, luteal. Yeah, she's in her.
You're there. I just want you to know you're there.
I'm a doctor, man. I'm a doctor
right there. Part-time doctor.
There.
Right. When you think of me, you think a doctor. You think
forget socialite, girl. Right. That's out the window.
Right. I don't want to be a socialite. I'm a doctor. That's right. It's like I got it. I'm nailing it. Tip of my tongue. But yeah, that's a good point. I think it's newer, and I can honestly see, not saying now, but like the next 10, 15, 20 years, it'll probably be discussed more and honestly probably taught more.
Yeah.
I can see that, right? Yeah. I feel like that's heading there.
Yeah. So I feel like we dive deep in all the like serious things we want. So what's we're going to go into like now like rapid fire, random, about you, about women, about health, about random things. So what's the weirdest thing somebody's got caught up in their vagina? Or anywhere.
I know what you're going to say to that. I know what you're going to say.
I don't have any personal stories with that.
Oh.
Isn't that wild?
Do you know one through somebody else?
I've heard like ER stories.
I thought you were going to say.
ER stories, like, because you got to imagine people have toys that they play with.
Yeah.
And like.
Yeah.
That's
funny. I mean, not really. But
no, like
people
get things stuck. But I don't have like.
Do you want one really bad?
This is the issue. This is the issue.
Like you want a good story.
This is the issue that I'm having in residency. There's like people that have white clouds and there's people that have black clouds. And what I mean by that is like when you're on service, like when you're working, a white cloud, a lot of bad things do not happen. It's a white cloud. It's great. People with black clouds, it feels like hell is happening. Like somebody's going for a crash C-section, somebody's doing this, and you're like running around. I have this little white cloud. And so a lot of like, I don't want to say cool because I'm not trying to, but like these interesting topics haven't really happened because like these bad things aren't necessarily happening when I'm on shift. So I don't have an answer to that. I wish I did.
No, that's fine. Because I always wonder.
But you hear stories.
I thought you were going to say HIPAA. I don't know why.
Or that. Yeah, I'm like, we don't have to go too detailed.
I don't know their names.
Do you have something?
Yes.
Go for it.
I'm going off your list.
Okay.
It was a good one. Where did you go? Oh, here we are.
I'm here.
Okay, let's see.
Here.
Where the funny questions go?
I'm like, I only had like one or two. Because my other funny questions are not related to women's health.
Oh, no. Yeah, you're right. Oh, okay. So my question for you would be like, getting into this role and everything and obviously like being like a Latino doctor and all that good stuff. Like, do you ever feel like, how do I say this? Like you weren't supported? Like, that old question, that old ditty of like, not that.
No ditty.
Not the
Edit that
ditty.
one.
Yes. We're going to cut that. We're going to
We
bleep
don't support.
it. Yeah. No. Especially on this podcast.
Yeah.
This specific episode.
No way.
That old thing, right? That old question of like, like haters are motivators. But like, do you ever feel like not supported? Your family seems very supportive. But were there other people that were like, go in a different direction?
No, yeah. I very fortunately feel like I had so many wonderful people placed in my life. That,
amazing.
Like, I felt supported at a lot of places. I will say, I feel like I had teachers in middle school. Mm-hmm. I had teachers in high school that overlooked me.
Yeah.
That didn't
always.
I feel didn't identify the potential that I had.
That's
because you can like see it. There are like teachers' favorites, and there's always that smart person, and the teacher may focus a little more on them or challenge them a little harder. And I would like to think that I like worked very hard in the classroom to the point where I was excelling at a level that most like I was matching people. I'm not saying I was better than anybody, but like if you're like a top performer, I was up there with them. And I felt a lot of times that like I was overlooked. Like even though I might have the same score or I might be getting the same achievement.
That breaks my heart.
Because you got to think I was raised in Kentucky.
Yeah.
There were so many times where I was like one of the only Latinos in my entire classroom. In my medical school, I was one of 2 Latinos out of 200 people.
Wow.
Like in my class. So even in med school, I felt unsupported and there was one instance like specifically like,
and you would never forget these instances.
This was like to this day like I'm pretty like mellow person. I don't really get angry that much, but this to this day when I think about it makes me so mad. Ooh. There was a situation at the end. Let's talk about this. At the end, you're about to get me fired up. I just want you to know this. At the end of medical school, where I had already matched, meaning I was in med school and I applied for residency and I matched at Northwestern, which is legit this top OB-GYN program in the nation. So yeah, let's celebrate, right? One of my end rotations of my 4th year was a pediatrics rotation, because remember I told you I was going to do peds. So I couldn't change every class, so I had to do this one peds rotation. And it was in the time where I was interviewing for residency. Like, so I had matched. Let me take that back. So I guess I had matched because I was still interviewing. So I was interviewing and I got an interview from this really prestigious school that had invited me to come out and visit them. And they were like, we'll fly you out here. We'll pay for your hotel. Like you have dinners. Like let us wine and dine you.
Oh yeah.
And it was part of like this minority initiative where they were trying to recruit their top minority students to come. And so I ran it by the attending, meaning like the head doctor I was working with that week. I ran it by them and they're like, oh my God, go. I ran it by the residents I was working with and they were like, oh my God, go. This sounds great. So I went, and then apparently I was supposed to have some like mid-clerkship review, like halfway through the rotation I was supposed to have a review. And so the clerkship director, who I don't work with directly, came looking for me and was like, oh, where's Isaac? And then the attending and the residents were like, oh, he had like this meeting at like this school. And dude, the director flipped his shit, like flipped and was like, absolutely not. He didn't run it by me.
Whoa.
Like, no way. Dude, I got failed. They failed me that rotation.
Wow.
Whoa.
They failed me that rotation. And like, I'm going to say this not to brag, but I'm going to make a point that I was a good student in med school. I just matched, or like I was interviewing at these top programs.
Right.
I had there was like this medical society. It's called AOA, like the top like academic students in your med school. I got inducted. There was gold humanism, like people that got identified for being humanitarian, like for their humanitarian aspect. I got inducted. So I was a good medical student and I had no issues in all of med school. and I got failed because I didn't show up for this mid clerkship. And the director, who's like, you know, this white old male, was so butthurt that I hadn't come to him and asked him for permission.
Oh wow!
And then there was this
power
one
structure right
there
there.
was you get evals at the end of your end of your rotation, and I got wonderful evals from most of the people except for one resident who from day one had an issue with me. Like day one, nothing happened, had an issue with me, wrote a horrible review about me, which doesn't align with any reviews I had for 2 years. Like I didn't have a single bad review written about me.
That's crazy.
And so I got failed. And so I went to my administration, who are all white people. Nobody looks like me. And I went like, hey, can you guys like help me? Like, what is happening? Like, clearly you see my grades are amazing. Like, clearly you see like I'm inducted to these honor societies. Clearly this one review doesn't align with anything ever said about me. Like, clearly I feel like I'm being targeted here. And they literally put their hands up and were like, oh, we can't do anything.
Wow.
Dude, I had to go through 3 appeal processes to get this.
Good for you for
Holy
advocating
crap.
for yourself.
Yes.
Because I feel like a lot of people, unfortunately, will become discouraged because they're like, I can't do anything. Clearly, it's a case of a power dynamic. I don't look like these people. So that's amazing that you pushed and pushed and pushed. And like more people need to do that.
Yeah. It was one of the most stressful times. And you're right. Like you have to have it. And it's sad that you have to advocate for yourself.
It's so sad.
You know, like
Yeah.
I really feel like in that process, there should have been somebody that looked like me that would have been able to take a step back and be like, is this right? Like, is this right? Like, you know what I mean? Like question. Because I feel like what happened is the administration was like, well, they're the clerkship director and they're the resident and they're at charge. So if they say it, it goes. Dude, there are people in power throughout this country in every field that you can work in that are corrupt. You know what I'm saying?
100%.
And this once again goes to why diversity is so important. There has to be people that look like us that can advocate on our behalf, because at some point somebody should have stepped in and be like, all right, let's pause. What are we actually doing here? Like this kid is about to match. You know, he has interviews at all these places. What are we helping him by failing him? And the thing is, I did good on the rotation. I just had one bad review that didn't align with anybody, and I missed my
It actually had nothing to do with your performance.
Nothing.
Exactly.
And what you're being assessed on.
It was a power trip.
Yes.
So when you ask me, like, do I feel unsupported? That's a prime example.
Wow.
Well, I'm sorry you went through
Yeah,
that.
that just makes me really sad because as a teacher, it's like now, like this is their most crucial time, high school.
Yeah.
Right? Because you're like in that, I don't even want to say the in-between.
The identity
because
phase.
It's the identity phase. And it's just this idea of like letting them know like they have power. And I remember I've told my students, like, somebody here is going to be my future child's pediatrician.
Facts.
Somebody here I could hire to be a lawyer. Somebody here is going to be a teacher, a coworker of mine one day. But everybody here is going to play an important role in society.
Facts.
Everybody, no matter what you do. And you have to believe in that power
Period.
too. So I'm glad at the end of the day, you did have teachers and supporters and family members who instilled that in you. Because honestly, I could only imagine, like you said, growing up in the South, you needed that reinforcement and the affirmations of hearing that. So God bless your mom and your sister and everybody for doing that. Before we wrap up, I mean, you seem like you're super busy, obviously, but you still make time to like do sports, work out. Like, how are you balancing your life? That too. Okay. How do you make time to like juggle that? Because somebody watching here, let's say like they are struggling with following their dreams because it takes a lot of time, or, you know, what do I want to do next? Like, what can you tell somebody that is scared of this idea of being a doctor?
Yeah. And like at the end of the day, my message is that you have to, and I know it sounds cliche, but you have to believe in yourself. There are so many people that are in a community where nobody, like what they want to do, for example, a doctor, they want to do it, and there's not a single person in their entire community, entire group of friends, entire group of family that has done it. And it's easy to fall into this trap of like, you know what? I haven't seen anyone else do it. I don't know what path to take. I'm not going to do it.
Yeah.
Like, don't let that be your excuse. Like if you want to do something, do not let you not seeing someone that looks like you be your excuse. You have to go for it. Because if not, you're going to get to a point where you really regret it. And the thing is, like, you can make it. Like, you really, really have to believe you can make it. Like, I am a firm believer that it is inevitable. Like, success is inevitable if you put the work in. Like, if you really are dedicated. If you're going to say, I want to be a doctor, and you're not putting in, if you're not putting the time to study and you're not putting the time to get good grades and you're not putting in the time to like ace your exams, all right, then like that's a you issue. But if you are putting in the hours, you inevitably will succeed. You just have to believe it. I'll be honest, because I'll say this from my personal experience. That's a lot easier said than done. I recognize that, I acknowledge that, because it is a frightening thought to be like, dang, there's not a single person, not even doctor, there's not a single person in my family that went to college. Like that's a scary thought, to be like, am I good enough? Like you have this like imposter syndrome. Like, and this is real within the Latino community. Imposter syndrome is like so real, because it's so easy to look at a field of lawyers and be like, wow, everybody in this room's white. Like,
I mean, that's how I feel sometimes in my doctorate program, right? Just like, in classes.
And you're doing it though. Like you believe in yourself, and you're.
Seriously, would you say both 18? Of you guys.
Yeah.
Well, he's already a doctor. Let's give him his credit.
I mean, of
give
course,
him the he's already there.
Look at you pursuing this. But
you said 18 months.
Anywhere between December 2025 to May 2026.
And you're gonna do it.
Holy crap.
You know what I mean?
That's like tomorrow.
And literally, and then you're gonna.
It doesn't feel like it though.
I know.
Wow. And you're gonna be able to do the same thing. As like, people inevitably will look up to you and be like, "Wow, look at her! Like she did it." And you have to believe yourself, and do not give yourself the excuse of like, nobody around me looks like me.
I agree.
Don't ever let that be your excuse.
Yeah, because then you will be that person for somebody else.
Facts.
Just gonna say that.
Like you will be the person at the table,
and
you will be the one to advocate for students who look like you when everybody else shuts the door.
Facts.
You're gonna be like, no, run that back.
Yeah, run that back.
Run that back.
Did you say you failed?
Like, hold on, what they say? Let me see that. Yeah,
Facts.
that's
love
awesome.
That. Well, thank you for being here with us today, for sharing your story and
thank
crazy
you guys.
questions. We're a little nuts, and I know pronounce half the words, but you know what? I'm learning.
But you're there.
I'm there. I'm here. I'm there. I'm
You
learning.
ready, girl?
I'm so ready.
She's gonna shadow you next week.
Yes.
3 doctors.
Shadow him.
Yes. You're looking at 3 doctors right here. Exactly.
Hello.
So producer Marco is gonna close us out with his chest.
He closes with his chest.
Yeah.
Oh,
He's been quiet.
I
He's
didn't
been
even know.
quiet this whole episode.
Yeah,
So I know you got something perking.
The only thing I have to say is what I've said before, which is hard work beats talent.
Facts.
10 out of 10 times. And that's an example
Period.
of what Isaac's saying. So I don't
Dr.
Dr. Isaac. Dr. Isaac.
No.
Dr. Domenech. But it's hard work beats talent every 10 out of 10 times. So if you don't want to put in the hard work, you're not going to get to your goals. It's very simple.
Facts.
So that's what I would say.
Say it with your chest. Yeah.
That's right.
I love it. Well, thank you so much. Make sure to follow us all on social at Paulina Rowe.
At Talk with Tati.
And what's yours?
Where can they follow you?
Yeah.
Can they follow
Instagram
you?
at Isaac.Domenech.
We'll spell it out.
Yeah, we'll put it on there. That's it.
I love that. All right. And of course, at Never Too Shy Pod. Thank you guys.
Bye.
Awesome. Thank you guys.